Hi, my name is Mary Cole. I'm an RN who does infection prevention and project management at my long-term care facility. I considered Synexis for my environment because of the overwhelming impact of COVID on long-term care facilities. In our facility in particular, we had so many deaths. We ended up closing our neurobehavior unit and our memory care unit several times because once something started in those areas, those type of patients are mobile and interact with each other continuously, and they don't follow directions. So whenever anything started in those areas, it was an onslaught of death or illness or just all kinds of bad things happening to them. I had evaluated Synexis based on a recommendation of a colleague who had been using it in their OR and was able to see very significant decrease in their orthopedic surgical site infections. For me, in our long-term care environment, we were having outbreaks related to COVID, which was the biggest thing on our issue list, but we often didn't have staff or extra staff to do extra cleaning. It was hard to find someone every day, let alone find something that would work 24/7, 365 for us. And in a long-term care environment, we never have empty rooms and empty areas for which to do some other interventions. Installing Synexis, it was a super easy process. It pretty much was done in one day. We initially installed around 50 units, and it really only took a day-ish to get them all installed. The company was great to come in and do them, and it moved along very quickly. So the best part about Synexis related to daily operations is that you don't have to do anything daily. It only requires maintenance twice a year, and that's just changing the filter. Really, it's something that you put in as a project, and you don't have to go and do anything with it every day. You don't have to QA check it. You don't have to go around on it every day. You don't have to make sure that somebody shows up to do that job every day. It's the little miracle that's quiet in the background, and it's always working. Really, the most valuable part of the Synexis system is that it is always working to keep your residents, your families, and your staff as safe as possible for whatever is going on or whatever will come along to the building. It's hard to quantify how much Synexis has helped for the air quality and cleanliness because it's a continual process. But what I can truly say is that I'm seeing less spread of things in the building, and it just seems to be working in the background to keep things from affecting everyone. What I've noticed in my facility after installing Synexis is outbreaks just don't spread. We can't always prevent everything from coming into the facility, but by chance it gets onto a unit where there's Synexis, one person may get sick. You can't avoid if you have face-to-face contact and somebody spreads a respiratory virus. However, it doesn't go beyond the person that was initially infected. It seems to stop very, very, very quickly. What I've also seen in units is that sometimes the outbreak never even gets traction and no one ever gets sick from it. We've had a situation where we had a divided unit with half of Synexis on it and half without. Same person exposed both sides. The side with Synexis had no one become ill, while the other side, most of the people became ill. So I think when you talk about us in long-term care, what Synexis has done for our facility is allowed our residents to have a life. If we have outbreaks or infections spreading or we're under quarantine, these poor residents who need socialization, need help with all their ADLs, and have psychological issues, anxiety and depression, if we put them in their room, With Synexis, we're able to allow them and encourage them to have a normal life and kind of maintain the best person that they can be with the needs that they have. My experience in working with Synexis is it's a really easy company to deal with. There's not a lot of layers. You're able to get the help and support you need and to work to make it a better environment for the residents. So I absolutely would recommend Synexis to others. Using Synexis is doing your very best to care for the entire organization, be it the residents or patients if you're in an acute care environment, the staff as well as the visitors. After what we've all been through, especially with COVID, and we don't know what is coming down the road next, we're really doing the best we can with the help of Synexis to ensure that people maintain the best life that they possibly can and take good care of our residents and give them the life they deserve.